Hello, my name is Dr. Kim Lampson, and I am a licensed psychologist who's had a private practice for many years, and I'm also an associate professor at Northwest University in Kirkland, Washington, where I work with doctoral students who are studying to become psychologists. I want to tell you about the helicopter story. The helicopter story is something that I developed back in the 80s as a way to help people in recovery, family members, and professionals who treat people with eating disorders understand why it is that a person would develop an eating disorder. The helicopter story is concise and easy to understand, and it's a memorable way to conceptualize the etiology of an eating disorder. In other words, how could somebody who seems to be going along with things going quite well in their lives end up with a mental disorder as serious as an eating disorder? So I'd like to share the helicopter story with you. When I present it to family members or people who come into my office for help, I tell them that I want to share this because it's a way to help us understand together what an eating disorder is and have a similar framework to use when we talk about recovery. I ask people to think about what I'm saying in the story as I explain it, and then at the end, ask the person and or the family members to tell me, based on what they just heard, why they think this person is struggling with an eating disorder at this time in his or her life. So I'd like to share this story with you now. The helicopter story is a short story with a long explanation. Here's the story. I'd like you to imagine that you don't know how to swim and you're going to take a trip in an airplane. So normally you get on the plane, you go to your destination, get off the plane, go about your business, you come back home, and it doesn't matter if you know how to swim or not. But now I'd like you to imagine this scenario. You get on the plane and the plane is going along and the plane crashes into water. You're the only survivor, and the only way you have to stay alive is by holding on to a life preserver. So you're floating in the water, holding onto the life preserver, hoping and praying that someone will come to save you, and you hear the sound of a helicopter. And you listen and realize a helicopter is coming in to save you. The helicopter gets closer and closer, and finally is close enough that the people can yell down to you, "We're here to help you." And they do. They say, "We're here to help you." And you breathe a sigh of relief. You think, "Oh, thank goodness, someone finally is going to come to rescue me." And then the people from the helicopter come down from the helicopter, they come over to you and they say, "We're here to help you. The way we're going to rescue you is by taking away your life preserver." And you look at them with a puzzled expression and say, "No, wait a minute, you don't understand. If I give you my life preserver, I'm going to drown because I don't know how to swim." The people from the helicopter say, "Well, we're sorry, but the only way we know how to rescue people is by taking away their life preservers." And you kind of stare at them in puzzlement and think, what am I going to do? People from the helicopter say, "You need to make up your mind." So you ask for a minute to think, and they say, "Okay." So you're floating in the water, holding onto this life preserver, trying to decide what to do, thinking, this feels like a lose-lose situation. If I tell the people from the helicopter to go away, I feel like I'm going to die of the cold before somebody else will come here to save me. On the other hand, if I hand them my life preserver, I know I should be able to trust them because they are rescue people, but I've never met these people before in my life. And if they don't help me immediately, I'm going to drown. So you're floating there trying to decide what to do, and you realize you can't make up your mind. Well, the people from the helicopter get impatient, and they say, "Look, we're tired of waiting for you. We're just going to take this life preserver away from you." And they reach out and they grab it. And you instinctively grab back, and there's a power struggle that follows. Finally, the people from the helicopter say, "Look, we're going to go on, and we need to rescue somebody else. We don't have any more time to deal with this. We see a rescue boat coming in. How about if we wait for that and get into that instead?" And you say, "That sounds like a really good idea to me. What I'm going to do, though, when I get into that rescue boat, is take this life preserver with me because I want to make sure if anything happens to that rescue boat that I will still survive." That's the story. Here's the long explanation. The plane represents a person's life. It's often a person who feels they would look better if they lost some weight. It's often a person who really values being thin and having control over their body and their shape. But it doesn't have to be. Life is going along, and then there's a crash in the person's life. And the crash can be one or more of about 10 things. And the first of those is a single traumatic event. The most common single traumatic event that is the final straw for someone before they develop an eating disorder is rejection in a romantic relationship. But there are many other traumatic events that affect a person just as deeply. It could be loss of someone really close to you. It could be a family member dies. It could be rejection in a friendship. It could be divorce of parents. It could be your own divorce. It could be anything that's very painful. And the person in that situation feels more pain than they know how to handle, and they don't know what to do with the pain. The second possibility is there are a cluster of things that happen within a relatively short period of time, say 2 to 3 years. And if only one thing had happened, maybe the person would be okay, but it's too much too fast. So it might be grandmother they're really close to dies, they're rejected in a romantic relationship, their parents get divorced, one of their family members gets very, very ill. It's too many things within a short period, and the person feels overwhelmed with the emotional pain and doesn't know what to do with the pain. The third possibility is that the person's experienced a lifetime of pain. The person might have grown up in a family where there was some form of abuse, physical abuse, emotional abuse, sexual abuse, or neglect that lasted over many, many years. And the person finally reaches a point where they just can't take the pain anymore. Or the person might have grown up in a family or married into a relationship with someone who abuses drugs or abuses alcohol. And the person has withstood that pain for a long, long time, and that gets to the point where they can't do it anymore. Or there might be somebody in the family who has a chronic illness that's been very stressful and has soaked up the attention of all the family members. And this person has gotten very little, and it's been very painful. And finally, the person can't take the pain anymore. The next possibility is that the person experiences the onset of a mood disorder or an anxiety disorder. Typically, people first experience these types of mood changes after puberty. So a lot of people become vulnerable during the teenage years because they really don't understand what's going on. So the person might feel really depressed, might have thoughts of hurting themselves, might have thoughts of suicide or death. The person might not want to do what they've done before, may not enjoy things, may withdraw from their friends. On the other hand, the person might become more anxious and start obsessing about things or having compulsive behaviors or having to do things in a ritualized way and not understand why. The person might be worrying, not able to sleep. The person feels scared by these feelings but doesn't want to say anything to other people because of the fear other people might think they're crazy. So the person keeps all this inside and doesn't know what to do with the pain. The next possibility is that the person grows up in a family where there's a lot of pain, but it's not talked about openly. And this person is a particularly sensitive child and soaks up the pain of that family and holds it inside, but because it's not talked about, doesn't know what to do with the feelings, and it becomes overwhelming. The next possibility is that the person grows up in a family or marries into a relationship where there's someone who's very controlling, and the person wants to please this person, wants to be what this other person wants them to be, and puts a lot of time and energy into doing that at the expense of developing their own identity. And finally, that person reaches the point where they just can't do it anymore. The next possibility is that the person experiences an isolated incident or repeated incidents of sexual abuse and keeps the feelings inside. Either are told not to tell what happened, or the person is afraid to tell what has happened, and the person has a tremendous amount of feeling and pain that they don't know what to do with. And the last possibility is that the person struggles with low self-esteem. It seems like some people struggle with low self-esteem from the time that they're born. It's not like something happens that causes this feeling. It's just always been there. And this person is desperately seeking for a way to feel better about her or himself. So the common thread in all those scenarios is that the person feels emotional pain that's too intense and that they don't know what to do with this pain. And at that point, the person becomes really vulnerable. The person also tends to isolate with the pain, even if they haven't done that in the past. And the person tends to isolate in one of three ways. Either by putting on a happy face, So people say, "How are you?" And the person says, "Fine, I'm great." But inside they're dying. Or the person becomes very irritable and agitated and prickly and pushes people away, so people don't want to get close. Or the person withdraws, like a turtle would pull its head inside the shell, and the person keeps all the feelings held deep inside. So here's a person who is alone with a lot of pain and is very vulnerable. Now this person is searching for a way to feel better and could find other things than an eating disorder. The person could find alcohol, the person could find drugs, the person could engage in self-harm, the person could begin looking at pornography, the person could be involved in multiple relationships, desperately seeking to find a way to feel better. But if the person develops an eating disorder, typically that person is in an emotionally vulnerable place, is also genetically vulnerable with a family history of eating disorder preceding this person's development of an eating disorder, and also has this overvaluation of their shape and their size. So here's a person who is emotionally vulnerable, genetically vulnerable, and their thoughts may predispose them to looking in the direction of an eating disorder, and then they go in one of two paths. And in the first path, the person begins to overeat. Frequently, the overeating will follow restriction. Most people do not understand the risks of restrictive dieting, and that one of the risks is binge eating. So the person begins to overeat and finds in food a friend and a companion, a source of comfort, something to do when they're online, when they're doing their homework, when they're watching TV. And this person either engages in binge eating and restricting or just engages in overeating and is more likely to follow a path that would lead to a binge eating disorder or obesity. And then other people will restrict their intake and lose weight. And these people continue to diet because there's a lot of positive reinforcement in our society still for weight loss. So the person starts to feel better about themselves, they're losing weight, they feel better, they feel more control, their self-esteem goes up a little bit, and that person persists in weight loss. And that person may add other behaviors as well, such as self-induced vomiting, laxative abuse, excessive exercise, diuretic abuse. That person's more likely to follow a path that would lead to anorexia nervosa or bulimia. But not everybody who overeats develops an eating disorder, and not everybody who restricts develops an eating disorder. Otherwise, almost everybody would have an eating disorder, whereas it's a very, very tiny percentage of the population that actually has an eating disorder diagnosis. It's the person who's emotionally vulnerable, most likely genetically predisposed as well, who stumbles upon this behavior and innocently begins to use the behavior, but finds when they overeat or restrict that they feel a little bit better. And those people may follow the path that leads to the development of an eating disorder. And when the behavior becomes like a life preserver for that person, that is part of the eating disorder pathology. The behaviors themselves help the person cope with emotional distress. So the person feels calmer, the person feels numb, the person feels distracted from their pain. The person has the illusion of control and the illusion of a way to feel better about themselves and holds on tight, and it becomes this life preserver that they don't want to let go. So when people try to help, those are the people from the helicopter. People come in to help, and people help based on common sense. And common sense would say if somebody's losing too much weight, you make them eat. If somebody's throwing up, you don't let them go into the bathroom. If somebody's abusing laxatives, you take away their laxatives. So the person tries to help based on common sense and does these things, and then the person with the eating disorder reacts defensively, does not want to let go of the behavior, does not see it as helpful, and often will become deceptive, manipulative, deceitful, do anything possible to hold on to their eating disorder behaviors. And a power struggle will follow. And the people trying to help are confused by that and say, well, I understand, I thought you wanted to get over this. And the person with the eating disorder may also be a little bit confused, but will say something like, well, I'm afraid of being fat, I'm afraid of gaining weight, or in some cases, I'm afraid of losing weight. There is another option, and the option is the process of therapy. And when people enter therapy, it usually takes about 1 to 5 years for a person to recover from an eating disorder. because it is such a complex mental disorder. And there are several things that determine the length of time a person will be in treatment or how long it may take their recovery, variables that affect this outcome. One of those is the relationship with the therapist. It has been found in the literature that the relationship with the therapist is extremely important to people with eating disorders. They're looking for a therapist they feel understands and does not judge and connects and can help and have hope for them. If someone is with a therapist where that's not present or they don't feel a strong connection, it's unlikely that the treatment is going to work very well, and it's better the person looks for a different therapist. Secondly is how willing family and other supportive people are willing to be involved in the treatment process. It's really helpful if family members can learn how to be supportive so they don't make the mistake of the people from the helicopter and don't end up in power struggles with the person in recovery, but learn what they can do that will help the person to resolve the problem. And family members and other supportive people can learn this from the therapists with whom they're working. The next variable that affects the length of recovery is how many things a person needs to resolve that's underneath their behavior. If the person has a lot of trauma and a lot of deep-seated issues, it may take them a little bit longer. Another variable is how long the person has had the eating disorder. And interestingly enough, sometimes people who have had an eating disorder for a long, long time are so highly motivated to get better that they actually do get better faster than someone who has just started in the behavior and is ambivalent about recovery. Next is motivation to change. There is that old joke of how many psychologists does it take to change a light bulb? Answer being one, if it's willing to change. And that's true in eating disorder recovery. If the person is in treatment because they want to be in treatment and really want to get better, the person will get better and will make it through recovery. If that person is determined to take as long as necessary to get over their eating disorder, remembering that it usually takes several years or may take many years, but it is so worth doing, even though it does take a long time. So that's the helicopter story, and I hope it's been helpful. If you are a clinician and sharing this with somebody at this point, you would say, please tell me now that you've heard this story, why you think you've developed an eating disorder at this point in time in your life. And if the person needs you to remind them of some of the variables mentioned in the story, then you would do so and help the person to answer that question. Thank you very much. You're welcome to contact me if you'd like more information.